Klippel-Feil syndrome is a rare congenital disorder that occurs during fetal development, involving fusion of two or more cervical vertebrae, mainly C2, C3, and C6, C7. The symptoms of Klippel-Feil syndrome can vary widely from person to person. Common signs include limited range of motion in the neck, short neck, and low hairline at the back of head. Individuals also experience headache, pain, or numbness due to nerve compression, along with altered spine kinematics and scoliosis. The exact cause of Klippel-Feil syndrome is often unknown, but it is believed to be linked to genetic, environmental, or spontaneous factors. Diagnosing Klippel-Feil syndrome typically involves following steps: clinical evaluation to assess range of motion, strength, and posture or asymmetries in the spine or neck. Functional assessment, that is how it impacts the person's mobility and quality of life. Pain assessment, which can be done through various techniques such as manual therapy or visual analog scale. Diagnostic test includes X-ray, which shows fusion and narrowing of vertebra as in spina bifida and scoliosis patient. CT scan, which shows spinal stenosis and degenerative changes in spine. MRI shows spinal stenosis, disc bulge, and herniation. Genetic testing may also be performed to identify any associated genetic abnormalities. Unfortunately, there is no cure for Klippel-Feil syndrome, but various treatments and management strategies aim to alleviate symptoms and improve quality of life. Surgical intervention may be necessary to address specific complications like spinal instability or nerve compression. Physical therapy can be beneficial to enhance flexibility and strength. Physiotherapy management includes pain management techniques, range of motion exercises, strengthening exercises, soft tissue mobilization techniques, posture correction, and breathing exercises. To learn more, you can read my article on KFS on my website physiofeed.com.